You are welcome again to my page. If you are new on this channel, do subscribe to this very channel. On this very episode, we'll be talking about what might lead to increase or decrease of vital signs, starting from blood pressure. When you talk about what might lead to increment of blood pressure, we talk about obesity, diabetes, and other health conditions. How will you know you have high blood pressure? A lot of times, high blood pressure doesn't come with signs and symptoms, no symptoms, but things like blurry or double vision, heart palpitation, shortness of breath, fatigue. Low blood pressure is a certain health condition that is caused by dehydration. When the amount of water in the body is not enough, the blood in the body tends to decrease, then by resulting to low blood pressure. Things that can cause dehydration is vomiting, excessive diarrhea, etc. When you talk about pulse rate, what might lead to high pulse rate, which is also known as tachycardia? It can be as a result of exercise or stress response, and is considered as a symptom, not a disease. What might lead to low pulse rate, which is also known as bradycardia, might be as a result of heart tissue damage related to aging. Things that can lead to high body temperature, also known as hyperthermia, are a viral infection, a bacterial infection, heat exhaustion, some inflammatory disease such as rheumatoid arthritis, a cancerous or malignant tumor, and some medications such as antibiotics and drugs used for the treatment of blood pressure and seizure. Then for low body temperature, things that can lead to low body temperature, also known as hypothermia, are prolonged exposure to cold, falling into the water like in boating accidents, being unable to get out from wet cloth or move to warm or dry location. Also, wearing a cloth that aren't warm enough for weather conditions. All this can lead to low body temperature. What might lead to high respiratory rates? Just like someone breathing high, might be as a result of anxiety, heart disease, dehydration, fever. Then when you talk about the low respiratory rate, it can be as a result of drug overdose or obstructive sleep apnea. Head injury can even lead to low respiratory rate. When it comes to respiration, it's a very serious issue, and when a person is experiencing abnormal breathing rate, that person should please kindly contact your doctor. When it comes to oxygen saturation, what might lead to low oxygen saturation are chronic obstructive pulmonary disease or pneumonia. Other things can lead to low oxygen saturation apart from this. Opening your windows or taking a walk around the vicinity can bring about increment of oxygen in your body. It might not be necessarily a health condition. When you talk about pain, things that can cause increments in pain, a lot of things can cause increments in pain. Burns, accidents, cancer. So it can be determined by the patient's response to that pain. Either is mild, moderate, or severe. Well, we don't have anything like low pain. It's either there is pain or there is no pain. So with all this listed out, now you know what might lead to increment or decrease of all these vital signs. So if you are having any of this, or you have somebody or your neighbor or anybody that has what I have listed, or even what I have not even listed, showing those signs and symptoms of the things we have talked about on this video, please kindly visit the hospital or contact your doctor. On my next video, we'll be talking about a new different topic. Stay tuned and kindly click this plus sign to get more of these head talks. Thank you. Bye bye. See you on my next video.